Yeah, so hello everyone. Good evening, good afternoon, or good morning um, for the time zone you are at the moment. I am Skander. I am the IFMSA Liaison Officer for Public Health Issues, and I'm really happy to organize this webinar on NCDs, which will actually serve for a consultation for the upcoming high-level events that will be happening in the upcoming weeks, namely the NCD Alliance Forum, which will happen in Sharjah in the UAE, which will actually start on Friday. And IFMSA will be represented there by our Vice President on External Affairs, Ms. Cornelia Macevichuti, and also the NCD's Global Coordination Mechanisms that is organized by the World Health Organization, happening on the 30th of November and 1st of December. We have here wonderful speakers that will be telling us about their perspectives on NCDs, their roles in their organizations and their field of work, but also about their perspectives on how we can raise our voice as youth organizations aiming to combat NCDs. So just to give you a bit of introduction on NCDs, on why we are talking about NCDs and raising it as a topic, namely saying that it's one of the biggest global health burdens nowadays. It was namely raised by several organizations, and mainly the United Nations that raised this second public health issues in 2010, and then following by several organizations, including WHO, the NCD Alliance that is founded by very big organizations such as the International Diabetes Federation, the World Lung Foundation, the United Union Against Control, etc. So a lot of people are wondering about what is the reality of NCDs on the ground, and there are a couple of myths that we might actually neglect. For example, if NCDs are the diseases of the aged, we could tell that 7 million deaths that are due to NCDs are actually happening below the age of 70. Or if we think if NCDs are the diseases of the rich, we could see that 80% of NCDs are happening in low and middle income countries. So just to tell you how much of a global health burden this is. And we'll be starting with our speakers, and I'll be asking a couple of questions to each and every one of you, and I'll be happy to receive your perspectives and if you have any experience that you would like to share. But also, we're asking the audience to share their questions and their experience on the comments of the Google event, and we'll be trying to respond after questions or at the end during the debate. So first, we're going to start with Jozo Schmuch, who's the IFMSA Public Health Director, or SCOF Director. So SCOF stands for Standing Committee on Public Health. And Jozo is going to tell us a little bit about himself, and also to give us a little bit of perspective on NCDs from your experience. Go ahead, Jozo.
Hi everybody, thank you Skander so much for your kind words. So as Skander said, I'm Jozo Schmuch. I am from Croatia and I'm the current Public Health Director for IFMSA. So actually my involvement with my national member organization, which is CROM6, started with the NCDs, and my first community education campaign that I participated in was actually a campaign. It was raising awareness about different types of cancer for children in high schools. After I became a local public health officer, and I hope there are a lot of public health officers watching us now, I organized my first campaign on myself, which was organized for the World Diabetes Day some years ago. I won't even say when, but it was a very big success for me because we were able to participate in a discussion in the Croatian Parliament where we educated the Parliament members about the diabetes and the struggles that people living with diabetes face every day. I wouldn't say suffer because they're living quite nicely if it's managed. And of course, we had a community education parallel to that, where we educated our communities about how to prevent diabetes and how to live with diabetes if you have diabetes as well. Later on, I got more involved as one of in IFMSA as one of the contributors to the NCDs and Healthy Lifestyles program that Hannah will, I think, present later, which was a really nice experience. And I, of course, continued working with the NCDs on a local level and on my national level. And later on, as I got involved in IFMSA, first as the regional assistant for Europe, I got a perspective from different countries in the European region, and later on as the SCOF director, or now as a SCOF director, I started getting more involved and accumulating knowledge on what's happening around the world with NCDs and with different countries. So yeah, I have a lot of experience regarding NCDs, especially primarily in community education and what medical students can do in the field of community education. And I'm also trying to learn more about advocacy and how to advocate for better conditions and better treatment for NCD patients.
That's great. Thank you, Yozo. So perhaps we can skip with diabetes since you mentioned and you seem really passionate about it. So can you tell us a bit more of the recent contributions on the World Diabetes Day, for example?
Sure. Sure. So I will post the link in a Google Docs, so in the Hangouts. So last year, I hope you participated, the SCOF international team led by Skander then decided to do an international campaign where people posted selfies or pictures with blue circles to raise awareness about diabetes. This year we wanted to do something different. We wanted to have a different approach, so we wanted to develop a toolkit, or actually upgrade a toolkit that was developed in previous years, where we gave our members ideas about different things they can do for World Diabetes Day, such as they can do education for medical students. One great way to do one great thing to do is MedCafe or Public Health Cafe, which is informal education for medical students and together with their professor about the public health perspective of diabetes, or how to organize community outreach and education. And so we developed a toolkit with the basic information that can be used by local public health officers, national public health officers, and everybody who's enthusiastic about public health and community education and changing something to gather ideas and to figure out what they want to do for World Diabetes Day. So I will post the link in comments so everybody can find it.
That's great. Thank you. Also, so you mentioned a couple of activities that national members can do back home, from educational campaigns to screening campaigns, etc. And what do you think the fact that this big momentum that is raised with the World Diabetes Day by several organizations is pushing organizations to do campaigns? But what do you think, for example, our national members can expect to bring back from those organizations, those very big organizations?
Sure. Speaking from a personal experience, the first time I organized something, and that was for the World Diabetes Day, I was in a collaboration with the national member of the International Federation of Diabetes. I'm not sure for the names, I'm terrible with it. In Croatia. Yeah. National Diabetes Association in Croatia, which was a really good experience because it was mostly for me and for my organization. It was a very nice experience because it was mostly created by people having diabetes and living with diabetes. And for me, it was a nice experience because I learned about normalcy of their life, and rather than seeing them suffer from diabetes, I learned how they live with diabetes. The other thing that was really good is that we had a collaboration for the community education. So it didn't just come from a medical student, it also came from the people who were living with diabetes and who had real life experience with diabetes. So it gave another layer to the community education and to raising awareness then in Croatian Parliament. So it was a good thing from that perspective. The other thing is, the people who know most about diagnosis and most about their illness are actually people suffering from that illness, and this is where people having diabetes can really help medical students learn about not just medical perspective of diabetes, but a public health diabetes and how it is to live in a certain system with that disease.
So definitely collaborating with patients and patients' organizations would be key to achieving a great impact on the society.
I would definitely say that, but also collaborating with the other professional organizations, such as with the doctoral or medical association, is also very beneficial.
Okay, sounds good. Thank you, Yozo. Don't forget that if you have any questions or comment, please feel free to share it on the comment chat. We'll be moving to Hannah, also from Croatia. We'll be having a Croatian dynasty over here. So Hannah, would you like to introduce yourself and tell us a little bit about your field of work? If you can unmute your microphone.
Yeah, I have some problems, sorry, with the internet connection. Hi everyone, my name is Hannah Luchev, and I'm a program coordinator for healthy lifestyles and non-communicable diseases. And as you already know, programs are a new platform in the IFMSA, and there was a transition from the project-based activities to program-based activities. And I know that for a lot of people it's a bit confusing now to understand programs if you haven't been directly involved in them, but actually it's pretty simple. So I was thinking about explaining a little bit why there are programs now. So the programs are all the activities that our members do locally and nationally and internationally, and it doesn't matter if they are one-day events or long-term projects, because they all have the same objective, and this is why they're in that specific program. As a program coordinator for NCDs, my areas involve mostly cancers, diabetes, hypertension, and chronic pulmonary diseases, but there's also accent on promotion of healthy lifestyles. So this is a short introduction about programs, and any questions about them, you can be free to ask them. But the thing is, as well as Yozo, I started in Kromsik in the SCOF. I was also an LPO, and this is why I was so involved with the NCDs. And I think there is a big potential in what everybody in their NMOs are doing about the NCDs and about kind of decreasing the burden of them.
Okay, thank you, Hannah. So perhaps to think about how making things concretely, since we're starting to implement this program system with taking the example of the World Diabetes Day, we'll hope that there will be good reporting from our national members. And how do you see these activities can be centralized in order to increase the impact in our actions?
Okay, so the program structure, it is meant to increase collaboration between the NMOs and also to give us important input what different countries and regions do about specific topic. Well, the way that it will improve collaboration between the NMOs is that different NMOs will be aware of the other activities that are being done in the IFMSA and maybe give them ideas how to use their initiatives in their own countries. And also, I, as a program coordinator, can help them and connect together different NMOs to improve collaboration and maybe give them advice if they have some problems. At this point, we have released a call for the application for the World Diabetes Day activities in the programs, and all the activities that will be applied in the programs and that will kind of pass that will be enrolled in the program will be in the annual report that I will present in the August meeting in Mexico. And it's actually pretty simple to enroll in the programs, because all you have to do is fulfill the enrollment form and to send a candidature form, and this is it. And so it's not really complicated, so I kind of urge everyone to do it, because it's really important for us to have the data and for you to kind of be more aware of what other NMOs are doing on that topic. I mean, even from last year, when we've done the baseline assessment, we have some information that tells us what different regions are doing, so we can maybe stimulate them to be more involved in the topics that are not so widely covered in that region. The thing about this database that if we have those kind of information, we can have a better communication also with externals and present them our work on evidence-based way, and it gives us more credibility when we have specific data on the activities. And we all know that there are a lot of activities that are being done in the IFMSA.
So you think that if we gather all the data that will be from our members, we will sure release a sort of evidence that can make us more credible with external organizations?
Yes, of course, because I don't know, in all the meetings that I have attended, like IFMSA meetings, there were a lot of initiatives and there were a lot of people who were talking about their projects and their activities and events. But I think that programs are actually here for to gather all of them in the specific topic. So we can, because if you don't go to a meeting and if you don't talk to specific people, you're not actually aware of what's going on. I don't know, it doesn't matter for World Diabetes Day or for Tuberculosis Day or for any kind of day, actually. And yes, I believe that this data will give us more credibility, because if we say, okay, so we had like in 80 countries all over the world, we celebrated World Diabetes Day, and we had, I don't know, X number of students who were volunteering, and we measured the glucose level in blood X number of times, it will be kind of really important to have those kind of numbers.
That's good. So we're looking forward to seeing this report, and hopefully it will be shown in a better shape that will help us raise our voice as youth organizations. So moving on to perhaps another topic, since we're also seeing a great momentum through the climate change negotiations and to adopt a climate agreement. There's a movement that is talking about climate and health, and where IFMSA is being involved, but it also raises the NCDs as a field that is linked to climate and climate action. Can you perhaps tell us more about it?
Yeah. So last month I have attended ADP, the UN Climate Change meeting, where I was a part of the IFMSA delegation. We had an objective to try to put health on the more visible and important place in the final agreement that will happen in December in Paris. Well, as you are surely aware, there are a lot of connections between climate change and health, but I think that the most important ones for the NCDs are about health co-benefits while tackling climate change. Actually, at this point, the action on climate change mitigation is seen as one of the biggest opportunities to improve health and well-being of the population. So I will just mention some of the co-benefits, but I think it will be enough for people to understand the importance of it. So some of the health co-benefits may include physical activity from walking and cycling, which can help prevent heart disease, some cancers, type 2 diabetes, and some obesity-related risks. Lower urban air pollution concentrations, which will decrease respiratory and cardiovascular diseases. Lower rates of traffic injury risks, and less noise stress. Also, it will the transport systems that prioritize active transport along with better urban land use can help improve access for vulnerable groups, which will enhance health equity. And I think that all these measures will surely improve the health of the population, together with avoiding the risks on health that climate change will have if we don't have a valid agreement soon.
That's really good. So we're hoping that negotiations will take this into account. So this is what IFMSA is looking for, and we'll be talking about it more in details in future webinars for sure before the COP21. Thank you, Hannah, for this thorough explanation and introduction on your field of work. And now we're happy to move on to our external speaker, which is Dr. Michelle Farmer. Dr. Michelle Farmer is a member of the NCD Child Governing Council and is a pediatrician with a public health background, mainly training in adolescent medicine. So perhaps, Michelle, you could tell us more about yourself and your field of work.
Yes, thank you very much for inviting me to participate in your webinar. I am representing NCD Child. This is a global multi-stakeholder organization that focuses on a life course approach for the prevention and the control of non-communicable diseases. So for that perspective, it involves looking at maternal health and looking at conditions even before pregnancy that might increase the risk of chronic diseases among mothers, and also prevention of non-communicable diseases among the children. Extend our efforts for prevention and early intervention also into childhood and adolescence. So this is why we call this the life course approach. The NCD Child organization works hand in hand with other coalitions like NCD Alliance, and we also focus on the priority of the prevention and control of the major non-communicable diseases, specifically heart disease and hypertension, cancer, diabetes, and lung disease. While, as you pointed out, while a lot of people think of these as problems of the elderly, many times the antecedents of these problems begin in childhood and adolescence, and actually data shows that up to 50% of chronic diseases can be prevented by altering and reducing risk behaviors of children and adolescents. And as you point out, the majority of these problems occur in populations that live in poverty. So we, as NCD Child, focus a lot of our attention on low and middle income countries. NCD Child is involved with a variety of activities that focus on advocacy and awareness. We've participated in the World Health Assembly for side events, and we've also participated with UN side events to the UN General Assembly that occurred in September. And we're very excited about the new developments that are occurring as a result of the recent adoption of the Sustainable Development Goals. These goals are broad-reaching, and we're especially happy about SDG goal number 3, which is to ensure healthy lives and promote well-being for all at all ages. And there are some specific targets for chronic disease. But as you also point out about climate change and environmental issues, these also can have some direct implications for the prevention and control of non-communicable diseases, and NCD Child intends to pay attention to those things as well.
Thank you, Dr. Michelle. So I'll be perhaps focusing on the prevention, like the primary prevention side within children. So how do you think, like what measures can be implemented within the indicators that we want to achieve by the UN SDG, so that we ensure healthy lives for those children?
Well, I think that prevention can start at a number of levels. I think at least at the macro level and the policy level, we need to be mindful of the need to have policies in place that limit access to tobacco products for children and adolescents. In some countries, there are young children, even as young as 10 years of age, who may be having cigarettes, and in other countries, exposure to alcoholic beverages, which also can contribute to heart disease and to diabetes. There is exposure to alcoholic beverages, and these are things that we think should be addressed at the policy level. At a community level, I think that there are still, again, other activities that can be done, things like limiting the access to unhealthy foods, such as fatty foods or very sweet drinks that might be available at a local store or a local market, that communities should be encouraged to increase access to healthy foods. And it's not just a community responsibility, but families and parents need to be mindful of the need for healthy foods. And along the lines of community and family, for physical activity, for exercise, for all children, not just those who are super athletes, but even those young people who may be at risk for obesity.
Thanks. I'm going to ask a couple of questions perhaps to the three of you, and if you have a specific answer, just let me know. We've seen in the agenda of the upcoming NCD Alliance Forum that there will be different workshops that are organized by high-level organizations about implementing national strategies, basically on the risk factors of NCDs, namely the unhealthy diet, tobacco, alcohol, and physical activity. And we've seen that there's a great potential for those strategies to get more attention, but we feel that we are perhaps kind of not reinventing the wheel, but sort of saying things that have been said before. So how do you think that this moment is the right one, and how do you think that we as youth and patient organizations, as the NGOs, can get involved and speak for the rights of the population that might need more attention, so that we can achieve a higher level of enjoyment of health? Anyone who would like to respond?
Well, I can at least start off. This is Michelle. One option could be mobilizing youth groups, as you've pointed out. I think youth action really has a big impact, and it's important for, I think, everyone to hear the responses of young people, because they are our future and they will inspire us to make change.
Thank you, Dr. Michelle. Yozo, did you want to say something?
Yeah, I totally agree with Dr. Michelle. I think it's very important to mobilize youth. I think as a youth we have a very strong, first of all, urge. We want to change something, but also we make a significant amount of the world population. So it's very important for us to unite our voices and advocate for something. I think it's still untapped potential, the youth is. So I see mostly youth moving forward. Speaking from a new viewpoint, I see youth moving forward and advocating for people who let's say can advocate for themselves. And also education, as Michelle said, it should be the prevention of the NCDs has to have few layers, not just one. And I think education pointed out towards youth is a very nice approach when it comes to the prevention of NCDs.
Great. Hannah, if you wanted to raise something, or maybe if you would like to raise any other topic, perhaps if we would like to talk about the issue, the advocacy tools that already exist and we might need to implement at the national level. For example, let's say that there is the Framework Convention on Tobacco Control that is a legally binding document for member states of the United Nations to implement measures. So this can be a great tool so that we can see what has been done in our countries and how we would like to advocate so that those measures can be implemented according to the context of our country. But also moving on to NCD's management, perhaps what do you think are the measures that are lacking within your organizations, or you think that patients are suffering from specific conditions that might need more attention that we can raise in those upcoming events? Anyone? You can also give your opinion on the chat. We already have a comment saying, well, yeah, we'll go back to this later because it's a question on the programs. So anyone would like to tell us a bit about NCD's management and how can this be implemented with a better attention? Yeah, Yozo?
Yeah, I actually like a point that you mentioned about the Convention of the Tobacco Control, and I will also write like that's a very good document which most of the member states I think signed by now. So people speaking from the advocacy perspective in the national member organization of IFMSA, people can check if their national program of the tobacco control is in line with the Convention on Tobacco Control, and to see if there are possible ways to improve it. Going back to the specific problems of NCDs and children suffering from NCDs, people can also check the Convention of the Right of the Child, which is now have been ratified, which means that it's been legally adopted by most of the countries. I think only US and Somalia, but I'm not quite sure about Somalia, are the only countries in the world who didn't ratify it, which means that all countries find it legally binding, and there are some specific points regarding health of the children. So it can also be used as the advocacy tool towards better health of the children.
That's great. Yeah.
Yes, this is Michelle. I also wanted to bring up something that I think is very important, and that is that a lot of people have also the perception that management of these chronic diseases, non-communicable diseases, is very expensive. But in fact, what I think can happen is a plan should be operationalized to integrate the prevention and control of NCDs into existing health platforms. As an example, in some of our low and middle income countries in the tropics where tuberculosis is prevalent, they should make sure that people who are being treated for tuberculosis do not smoke, that smoking prevention should be a very integral part of what they're doing with tuberculosis. Now, they have made some very good steps to integrate HIV care and treatment and HIV screening in tuberculosis programs, given the high correlation. But I think we should reach further and integrate anti-smoking campaigns into tuberculosis. Also, data shows a high correlation of diabetes and tuberculosis. So therefore, in these programs, it wouldn't cost a lot more just to do a simple one blood test to screen for diabetes among those who are living with tuberculosis. So I think some of our management strategies can be done at very low cost with very broad impact. I should also point out that the World Health Organization has done a wonderful infographic about maternal mortality. And in that graphic, it shows that the most common causes of maternal mortality are things like hypertension in pregnancy, chronic underlying diseases such as diabetes or obesity. And we know then that a significant cause of maternal mortality may be related to factors that are also linked to non-communicable diseases. So I think we can manage these problems by integrating NCD screening and prevention, and in some cases management, into maternal health programs. And from my point of view, I think this is a best buy because it will help improve the health of the mother and the health of the newborn baby. Thank you.
Thank you, Dr. Michelle. So it seems that the issues are pretty much interlinked, and with this global double burden of disease, we can tackle it by tackling only one issue, and we're aiming by making it very much cost effective, as you explained. But perhaps raising the issue of finances, since it's one of the biggest challenges that is being raised with this third Sustainable Development Goal by achieving health for all. It seems that a lot of money has been used for the Millennium Development Goals, and for this upcoming agenda, there are several strategies that are being discussed, and one of them is actually having money from the private sector, since it's one great provider of the money. do you think that this might be a very much sustainable strategy, or do you think that there are other ways, for example, from the Best Buy policy, such as raising taxes and other strategies? Anyone who might have an opinion about it? Yoza? Yeah.
I think it actually depends on the economy of the country, because raising, of course, speaking, I presume you're speaking about raising taxes on the tobacco and alcohol products, for example. Yeah, I think that's a very good policy, and I think it's in line with the Convention on Tobacco Control. However, I think we need to take a step further and have sugar taxes in most of the country, which is not happening right now. And as some models showed, I think in Mexico they had a law that was overthrown a couple of months ago. The money could have been effectively used both for prevention and screenings of the diabetes, the money they gathered from the sugar tax. So I think that's a very nice way to move forward, and it's something that people can advocate for example, establish the sugar tax within their countries. Now, I have a bit of a problem with getting money from the private sector regarding health, because it opens a Pandora box, I think. I think in some aspects. A specific example that I have is the alcohol industry, which has been giving a lot of money to alcohol prevention, but I think that's a very big conflict of interest when it comes to measuring the impact of the activity, because of course there's some space to modify the results afterwards. So I think it's not completely it's not without a conflict of interest. So I think we should be really careful with getting money from the private sector, and if we are getting money from the private sector, be quite aware of which private sector that is, and control the influence that comes with that money, basically.
Perhaps I would like to ask this question to Dr. Michel about the specific examples of Coca-Cola and McDonald's, if you'd like to respond.
Yeah. Yes, I think that the private industry does present, in my view, it could be an opportunity as well as a limitation. For example, it would be great to see some of these companies take on the responsibility of providing only low-sugar beverages. I think that would be possible, because now when I go to the market, I find a number of products, and some of them are actually now been bought out by these big companies, some of which you've named, and they are very good low-sugar products. I was in the market on the weekend, and I found this company. They're making vegetables in cans, and they have two versions. Both of them are very tasty. And one version, a serving will have 500 milligrams of salt, and the low sodium version has 10 milligrams of salt. So I think that some of these companies could be responsible and not make that high salt version, just make the low salt version, just make the low sugar drinks. And I think that proportions are also important as well. Don't make the super duper burger and the super duper size, but make a human size. And I think these are very good messages, and it would show everyone that maybe these companies are going to try to get it right.
Yeah, so I guess that we are somehow getting there. We just have to like bring the message as it is to the organizations, and stand up to make things happen at some point. Yozo, you wanted to add?
I think you raised a very, very valid point, and in the States and in Europe we saw a trend of organic and healthy lifestyle really going on, with the big supermarket chains buying small companies producing organic and healthy choices with food and drinks. And I think that's a very, very good, let's say, indicator for the future of healthy foods and the availability of healthy foods, and the changing of our of our perspective on food as the humanity, as the species, and we see that the trend wasn't actually brought by policy, but it was brought by the popular demand because people asked for it. So I think that's something that we have to be aware of, that community education actually plays an important part, because if people start asking for healthy foods, the industry will supply it, because then it brings money to it. But one thing that I also want to raise, especially when it comes to the food and to drink, is the advertising goals of a specific member organization. If we are talking a member state, if we are talking about UN or just state in general. And one of the problems that I see in Croatia is the advertising of the children-sized menus in fast food restaurants, and I think that's a very big problem, because it's a very fun thing to get a hamburger and then a toy and then a fries, and I think it's a very nice approach to children, and it's something that we have to be aware of it as well, because NCDs, as many things in health, to solve the problem of NCDs and to lower the suffrage of NCDs, we have to have a multi-sectoral approach, and I think advertising is often left out, except in tobacco, but in food is really left out, because food is open market for everybody. So it's just something to raise awareness about the advertising in the food industry.
Very good. Thank you, Joseph, for your perspective that you just shared. Now moving on to the second high-level meeting, which will happen in Geneva, which is the Global Coordination Mechanisms on NCDs, which is an initiative that was started by WHO a couple of years ago in response to the need to organize a structure that is coordinating NCDs, this global health burden, and tackling one of the challenges that are being one of the challenges that is being raised, and this time we'll be mainly tackling international collaboration, and namely North-South and South-South collaboration. We could see it from different perspectives in terms of how should these countries or regions collaborate. Is it in terms of practice and knowledge transfer, or is it more of like to share the know-hows or the workforce that would help other countries to achieve their targets? But also it would also come to financing specific projects that can achieve a better health for all. So perhaps I would like to see your opinions in terms of how this collaboration should happen. Perhaps also to think about what we are doing at the medical students level. How, for example, our national member organizations can collaborate, whether it's by joining hand in hand from the South-South collaboration or North-South, or to make a triangle collaboration so that every member or every let's say every party is involved. Hannah, perhaps if you have any thing that you'd like to share with us.
Well, I think that this is a really important meeting, because it is the first meeting about the NCDs after the sustainable goals have been adopted, and considering with everything that has been adopted in the sustainable goals, and there has to be a reduction of the burden of the NCDs for 1/3 in the future. And I do believe that at this point it will be important to have a better collaboration between the developing countries and the developed countries. So what actually I think is that there will be kind of a lot of talking about what will be done, not maybe trying to kind of change some ideas, how maybe the financing can be developed, some mechanisms that will help the developing countries. But I'm not actually really sure what will happen. We have to see that.
Yeah, we're looking forward to this, and this is why there are a couple of pre-dialogues that are happening, namely the pre-NCD I don't know if I call it pre-NCD Alliance Forum, but there will be a short meeting happening before the NCD Alliance Forum, but also before the NCD GCM dialogue. And this is where NGOs will meet together and share their perspectives, and this is why we are here to think about perhaps what can IFMSA and perhaps have the perspective of NCD Child as well in terms of how we want to get involved. Dr. Michel, you wanted to? Okay, go ahead.
Yes, I just wanted to bring up too how encouraged I am by seeing young people like the three of you who are part of this dialogue. The Global Coordination Mechanism is a very important opportunity, and I'm hoping that as part of this Global Coordination Mechanism, that there will be an effort to remind our member states of the importance of this life course approach, that we need to make sure that youth are engaged and youth participate in this north-south and south-to-south collaboration, that you all have very good perspectives and ideas. We need new ideas. We need new energy. We need to change the perspective that these are diseases of old people, but that these are issues of concern for young people, children, adolescents, and adults. So that's one important issue that the Global Coordination Mechanism must embrace. The other point I want to make a little bit of what Yusa was saying is, that these are important issues that need to be addressed from a very broad framework. And we want to make sure that we consider the fact that many of these countries have a very large population under the age of 25. If we're going to make a good plan for the entire planet, we must think about what the cultural and the country composition is with regards to the population. And we have numbers of countries where the population is very young, and the Global Coordination Mechanism must consider this in the context of meaningful prevention and control of NCDs. Thank you.
Thank you, Dr. Michel. Perhaps I can add that on behalf of youth organizations, we can raise the fact that we are caring about the future generations, and this is why we are trying to enhance the prevention measures, but also there are a couple of measures that can be implemented very easily, such as peer education and peer education sessions that might have a very relevant impact that is getting more and more evidence on it, but also in terms of how can we move from these peer education sessions to really implementing a sustainable strategy that, for example, can change the habit of those target groups, which are mainly children and adolescents, and how they can get the great and healthy lifestyles that they can keep until being adults and also preventing a lot of NCDs. Yozo, perhaps would you like to add something, or?
Sure. I actually agree with everything as you said normally. But the one thing that I want to do is to share a message with IFMSA members who are listening in, and it's about us as the organization having our representative there. I think it's very important to be aware that they are representing all of you. For me, always when I saw reports and from the delegations, I was really proud and really happy to have a voice of youth there, and I think IFMSA and RLE as an officers are doing an amazing job of representing IFMSA and the interest of, I wouldn't say interest, but the voice of medical students at this high-level meeting. And I think the IFMSA is really, really taking a huge step forward in representing youth in that way, together with other youth NGOs. So I'm really proud of that, and that's the only thing that I wanted to add.
Thank you, Yozo. We're actually doing our best because we think that we want to make this process very much inclusive and trying to have the input from everyone, and we're looking forward to having more input until these meetings are happening. And if you have any feedback or anything that you'd like to address, also for Dr. Michel, since she's getting acquainted with our organization, we're very much happy to try to see how we can improve things. Well, if you have anything else that you'd like to address, otherwise we can move on with the closing notes. If you'd like anyone to share anything that you'd like to conclude with this meeting, or things that you are looking forward to doing in the upcoming weeks. Hannah, would you like to start?
Well, actually, I would like to answer the question that has been posted about the enrollment process for the programs. Is that okay, Iskander? Yeah. Okay. So all the past activities have been in the baseline assessment. So no past activities are enrolling now in the programs, and for now the activities have to be enrolled before they start. So for World Diabetes Day, they have to be enrolled before the World Diabetes Day is. And for all the other activities that are not for the World Diabetes Day, they have to be enrolled at least 4 weeks before the activity starts, per the bylaws. So that's it.
Thank you. Any closing notes, like anything that you'd like to share before the webinar ends?
Yeah, I would really like to say that I really enjoyed this webinar, and I was really happy to hear opinions and thoughts from Michelle. I think it was really, really nice, and I think it's a start of a wonderful collaboration. And I think for the future we can look forward to similar webinars, and they will be very productive. And yeah, that's it. Thank you.
Thank you. Dr. Michelle, would you like to go ahead?
Just to make the comment that I agree with Yozo and Hannah, and also you, Iskander, that NCD Child would welcome the opportunity to explore opportunities for collaboration and working together. I think together we can be stronger and have big impact. And for those who are listening, it's always a great opportunity to hear from you. Sometimes you're thinking about what you're hearing, what people are saying, and then you come up with, oh, I've got this idea. It's never too late to share your ideas. So I am looking forward to the future and future dialogue with you. Thank you.
Thank you, Dr. Michelle. We'll also be introducing you to Cornelia, who will be representing us at the NCD Alliance Forum. She'll be also at the meeting, at the sort of pre-meeting that is happening on Friday. At the end, last but not least, Hannah, would you like to share any closing notes about perhaps your representation at the WHO TCM dialogue? Sorry.
Dialogue? Yeah. Well, first of all, I'd like to thank you all. And I really enjoy being a part of this, and I really hope that I will do my best to represent the needs and objectives of the IFMSA in Geneva, and I'm looking forward to working with Cornelia and to kind of do our best to kind of present our objective on the NCDs. Thank you,
Thank you, Hannah. Thank you, everyone. I'm not sure if there are other questions, but feel free to post on the comment chat, and we'll be happy to follow up on that until the events are happening in order to collect and present a very solid strategy. Thank you, everyone, for attending this webinar, and we hope to see you very soon. So, bye-bye.
Thank you very much. Thank you. Bye-bye.
Dr. Michelle. Thank you, Hannah and Yozo.
Bye.
Bye.
Bye-bye.